Welcome to LexCura Clinical Insights, the podcast where clinical evidence, healthcare standards, and litigation strategy come together. I'm Michelle Carroll, founder and chief clinical strategist of LexCura Summit. Medication errors in acute care are rarely the result of a single isolated mistake. They occur within a complex system that includes the physician's computerized order, pharmacy verification, the electronic medication administration record, barcode scanning, bedside administration, and the patient assessment that follows. Because the evidence is distributed across multiple records, the challenge is to reconstruct the entire medication pathway and identify exactly where the safety process failed. In this episode, I will explain how the acute care medication system is designed to work, how to compare each layer of documentation, and how to trace a medication error from the original order through administration, recognition, and patient harm. Okay, so here's something that might surprise you. Studies show that medication errors impact at least 1.5 million people in the US every year. That's not just a statistic, it's a staggering reminder of how fragile our healthcare systems can be.
Wow, that's a huge number. And what's even more unsettling is that these errors are often preventable. It's not like we're talking about some unavoidable phenomenon. These are mistakes that slip through the cracks in a system that's supposed to protect people.
Exactly. And what's fascinating and terrifying is how these errors happen. It's rarely just one person making a mistake. It's usually a chain of events, a series of small missteps that snowball into something much bigger. Today we're going to break down that chain and figure out where things go wrong.
That's such an important conversation to have. Medication errors aren't just about one bad decision or one faulty system. They're about how all the moving parts in healthcare, doctors, pharmacists, nurses, even technology interact. So where do we start?
Let's start with the basics. Medication errors can happen at any stage of the process, when the drug is prescribed, when it's dispensed, or when it's administered. And they can take a lot of forms. It could be the wrong drug, the wrong dose, or even the wrong timing. Sometimes it's as simple as a decimal point in the wrong place.
And what's scary is how easily those small mistakes can slip through. For example, I read about a case where a patient was supposed to get 2 milligrams of a sedative but ended up receiving 20 milligrams. That's a 10-fold increase, all because someone missed a decimal point.
That's a perfect example of how a tiny error can have massive consequences. And it's not just about the people involved. The systems themselves can be flawed. Take electronic health records, for instance. They're supposed to make things more efficient, but they can also introduce new kinds of errors. Imagine a drop-down menu with similar drug names. One wrong click, and you've got a problem.
Right. And technology can create this false sense of security. People assume that because it's automated, it's foolproof. But the reality is, technology is only as good as the people using it. And when you combine that with the high-pressure environment of healthcare, it's a recipe for mistakes.
And let's not forget about communication. Miscommunication between healthcare providers is a huge factor in medication errors. A doctor might verbally order a medication, and the nurse might mishear or misunderstand the dosage. Or the doctor might use medical jargon that the nurse isn't familiar with.
That's such a good point. And it's not just verbal communication. Written communication can be just as problematic. Think about handwritten prescriptions. If a doctor's handwriting is unclear, it can lead to all kinds of errors. That's one of the reasons so many hospitals have moved to electronic prescribing systems.
But even those systems aren't perfect. They can introduce new kinds of errors, like selecting the wrong drug from a drop-down menu. And then there's the issue of workload. Nurses and pharmacists are often stretched so thin that they don't have the time or mental bandwidth to double-check everything.
Absolutely. And it's not just about the number of hours they're working. It's also about the complexity of their tasks. Imagine a nurse managing multiple patients, each with their own medications, dosages, and schedules. It's a lot to keep track of, and mistakes can happen when you're juggling so much at once.
And that's where the chain reaction comes in. One small mistake, like a misread label or a missed decimal point, can set off a series of events that lead to a much bigger problem. It's like a domino effect.
So what's the solution? How do we fix a system that's so complex and so prone to error?
I think it starts with acknowledging that no system is perfect. Human error is always going to be a factor, so the goal should be to minimize opportunities for error. That means designing systems that are as foolproof as possible.
I agree. And part of that is about creating a culture of safety. Healthcare providers need to feel comfortable reporting errors or near misses without fear of punishment. If people are afraid to speak up, problems are going to go unnoticed and unaddressed.
That's such an important point. A lot of times there's this culture of blame in healthcare, but blaming individuals doesn't solve the problem. It just makes people less likely to report errors in the future.
Exactly. And that's why it's so important to focus on systemic solutions. For example, implementing barcode scanning systems can help ensure that the right medication is given to the right patient, or using color-coded labels to make it easier to distinguish between similar-looking medications.
Those are great ideas. And I think education is another key piece of the puzzle. Healthcare providers need to be trained not just on how to do their jobs, but also on how to recognize and prevent errors.
Absolutely. And that education needs to be ongoing. Medicine is always evolving, and so are the systems and technologies we use. Healthcare providers need to stay up to date on best practices and new developments.
So what's the takeaway here? If we had to sum up everything we've talked about today, what would it be?
I think the main takeaway is that medication errors are a systemic issue. They're not just the result of individual mistakes. They're the result of a complex system with a lot of moving parts. And if we want to reduce errors, we need to focus on improving that system as a whole.
Well said. It's about creating a culture of safety, designing better systems, and providing ongoing education. It's not an easy fix, but it's so important.
Absolutely. Because at the end of the day, it's about patient safety. And that's something we can all agree is worth fighting for.
Thank you for listening to Lex Cura Clinical Insights. An acute care medication case must be analysed as a sequence, not as a single administration event. The physician order, pharmacy review, EMR, barcode record, nursing documentation, medication timing, dose, route, patient identifiers, vital signs, laboratory results, and post-administration assessments should all be aligned into one clinical timeline. The key questions are whether the order was correct, whether the pharmacy identified contraindications or interactions, whether the medication was administered as ordered, whether barcode safeguards were bypassed, and whether the patient's response was recognized and addressed promptly. That process allows you to identify where the system failed, which provider or department departed from the required standard, and how the error contributed to the patient's injury. For more clinical intelligence, litigation analysis, and practical guidance, visit Lex Cura Summit at lexcurasummit.com. I'm Michelle Carroll. Thank you for joining me, and I'll see you in the next episode of Lex Cura Clinical Insights.